Good afternoon. It's approaching 4 o'clock. The COVID inquiry is about to publish its findings into how the government handled the pandemic. We're going to be hearing from Baroness Hallett, who chaired the inquiry, in a few minutes. But now those findings have been published, we can cross to our health correspondent, Ashish Joshi, who has been following this story for us today, has been poring through the inquiry. Ashish, what are you able to tell us?
I'm able to tell you that this is a scathing and damning assessment of the UK government's response to the COVID-19 pandemic. I'll start reading some of the report findings. And Baroness Hallett, you were saying you're going to be hearing from her in about 6 minutes' time. That's when she'll be presenting her own findings in her own words. But this is what she had to say. She said, this is the chair of the UK COVID inquiry, Baroness Hallett. She said the response to the pandemic by the United Kingdom's 4 governments was too little, too late. All 4 governments failed to appreciate the scale of the threat or the urgency of the response it demanded in the early part of 2020. It goes on to say some 23,000 lives in England alone could have been saved had a mandatory lockdown been imposed immediately after the 16th of March. That's a week before that lockdown was actually imposed, remember, on the 23rd of March. And it says the various lockdowns of 2020 and 2021 undoubtedly saved lives, but they only became inevitable because all 4 governments got their responses wrong. It goes on to say the Department of Health and Social Care misled the public by giving the impression that the UK was well prepared for a pandemic when it clearly wasn't. And by the time the possibility of a mandatory lockdown was first considered, it was already too late and a lockdown had become unavoidable. It goes on to say the UK government introduced advisory restrictions on the 16th of March, including self-isolation, household quarantine and social distancing. But had restrictions been introduced sooner, that mandatory lockdown from the 23rd of March might have been shorter or not necessary at all. There was no lockdown exit strategy. All 4 governments didn't have one. They didn't know what to do after they imposed lockdowns. There was no planning for a second wave. None of the 4 governments gave enough attention to the possibility of a second wave, meaning there was very little contingency planning in place. And it goes on to identify the people who are most impacted by the pandemic and the government's failure to protect them. It said no consideration of the impact of lockdowns, in particular the impact on the vulnerable and disadvantaged, and the impact of school closures on the children's education and their physical and mental health. None of the governments in the UK had adequately prepared for the challenges and risks of a national lockdown. And then it goes on to say, it talks about the politics, it talks about the characters, the leadership that should have been at the heart of this response to the pandemic. It said the UK cabinet was often sidelined in the decision-making. At the centre of the UK government, there was, and this is Baroness Hallett's own words, a toxic and chaotic culture, the destabilising behaviour of a number of individuals, and it goes on to name Dominic Cummings, an advisor to Prime Minister. And by failing to tackle this chaotic culture, and at times actively encouraging it, Mr Johnson, the then Prime Minister, reinforced a culture in which the loudest voices prevailed and the views of other colleagues, particularly women, often went ignored to the detriment of good decision-making. Allegations, and this is very important because this was a very contentious point during the pandemic. Allegations of rule breaking by ministers and advisors caused huge distress and undermined public confidence. Remember, at the time, while this argument was raging, it was said that these were minor indiscretions and that they wouldn't really impact the general public. Well, that's been found not to be true. And another one, the rules. You'll remember all the confusing rules around lockdown, different regions, different areas having their own. Law enforcement by the police was practically impossible because of the confusion surrounding the rules. And the public, it says, could not follow the complexity of the rules because of variations across all 4 nations. Baroness Hallett goes on to make 19 key recommendations in her report, and she will want those implemented within the time frame she has set out. So this is the strongest possible answer by Baroness Hallett and the inquiry to all those critics who've been saying this is a very costly waste of time, that this inquiry will find very little, it will take too long, and nothing will ever change. But this is module 2. There are still at least 4 more modules to go. If after module 2, Baroness Hallett has come to this withering assessment of the UK government and all 4 nations' response to the pandemic, this will make her critics think again about being so negative about this inquiry. Just a little way away from here is a COVID memorial wall where the families of the bereaved are gathering to give their response to this report module, to this report. They want answers, they want accountability. That is not within the remit of this inquiry. But what Baroness Hallett has certainly done within this report is told us who did what wrong, who did what poorly, and who didn't do what they were supposed to do. It's easy to put names to those departments, like the Department for Health and Social Care, and those ministers who alleged indiscretions, who behaved beyond lockdown rules. All of that undermined the government response. So we know who those people were, and we'll have to wait to see what they say about Baroness Hallett's report, and the fact that she's named Dominic Cummings, named Prime Minister, or the then Prime Minister Boris Johnson, and the fact that they should have been taking a much stronger leadership role, but in fact they were overseeing a toxic culture right at the very heart of government.
And Ashish, you've really dug into that report after looking at it for a number of hours, and you refer to the fact that Baroness Hallett has made a number of recommendations. I mean, this is still early days in the inquiry, isn't it? We're only at, as you say, module 2. What kind of things is she suggesting that we could be doing to not repeat the lessons of the past?
Communication. She wants to see stronger communication, stronger leadership at the heart of government, and then she wants to make sure that central UK government can talk to the regional or the devolved authorities and all work together, because clearly it was a mess from start to finish, and she doesn't want to see a repeat of that happening again.
Ashish, thanks very much. Ashish Joshi there, who has been going through this coronavirus report in great detail. So just as he was saying there, a scathing and damning report. Baroness Hallett is now speaking. Let's cross to her.
This report concerns the core political and administrative decision-making across the UK in response to the COVID-19 pandemic, drawing on the work of 4 of the inquiry's modules. Module 2, United Kingdom, Module 2A, Scotland, Module 2B, Wales, and Module 2C, Northern Ireland. It covers the period from the emergence of COVID-19 in January 2020 until the final restrictions were lifted in May 2022. Bringing the 4 modules together in one report has taken a great deal of work. But it has provided the inquiry with the opportunity to compare and contrast the different choices made by the 4 governments in responding to the same emergency, and to identify the most important lessons for responding to future UK-wide emergencies. In the inquiry's first report, The Resilience and Preparedness of the United Kingdom, I concluded that the UK lacked resilience and was ill prepared for dealing with a catastrophic emergency, let alone the coronavirus pandemic that actually struck. Against that backdrop, this second report examines the response to the COVID-19 virus and how the UK government and the devolved administrations made the high-level decisions to combat it. It assesses whether those decisions were reasonable and made on the best available information. Most importantly, it considers whether the appalling loss of life from the COVID-19 virus and the devastating socio-economic consequences that ensued both from the virus and the response could have been reduced. While the lockdowns of 2020 and 2021 undoubtedly saved lives, they also left lasting scars on society, the UK economy. They brought ordinary childhood to a halt, delayed the diagnosis and treatment of non-COVID health conditions, exacerbated societal inequalities, and had a severe impact on people's mental health. These are all issues being explored in other modules in greater detail. In the face of a novel and deadly virus spreading rapidly around the country, politicians and administrators in the UK government and the devolved administrations were presented with unenviable choices. Whatever decision they took, there was often no right answer or good outcome. They also had to make decisions in conditions of extreme pressure and initially without access to data or a full understanding of the epidemiological position. To assess what was reasonable, one must therefore put the decisions into proper context. Nonetheless, I can summarise my findings of the response as too little, too late. All four governments failed to appreciate the scale of the threat or the urgency of response it demanded in the early part of 2020, relying in part on misleading assurances that the UK was properly prepared for a pandemic. Once the scientific community and the scientific advisors for each nation had become aware that the virus was causing substantially more cases of moderate or severe respiratory illness in China than was being officially reported, and that it had spread from China, the warning signs were there. The tempo of the response should have been increased. It was not. February 2020 was a lost month. There was a serious failure by all four governments to appreciate the level of risk and the calamity that the UK faced and the need to inject urgency into the response. The obviously escalating crisis required leadership from the very top. All four governments knew that in the reasonable worst-case scenario, up to 80% of the population would be infected, with a very significant loss of life. At the same time, it also became clear that the test and trace system was inadequate for a pandemic as a result of flawed pandemic planning. Yet still they failed to take the necessary steps. This meant a national lockdown became more likely. The inquiry does not advocate for national lockdowns, far from it. Restricting people's liberty in such a draconian fashion, with all the devastating consequences, should be avoided if at all possible. But to avoid them, governments must take timely and decisive action to control a spreading virus. The four governments of the UK did not. Had the more stringent restrictions short of a stay-at-home lockdown announced on the 16th of March 2020 been introduced earlier, when the number of COVID-19 cases was lower, the mandatory lockdown that was subsequently imposed might have been shorter. Conceivably, it might not have been necessary at all. At the very least, there would have been time to establish the effect of the restrictions on levels of incidence and whether there was a sustained reduction in social contact. As it was, the likelihood of a mandatory lockdown significantly increased as a result of the failure to act more speedily and effectively before the 16th of March. By mid-March, the UK government and devolved administrations had received clear and compelling advice. The exponential growth in transmission would likely lead to a loss of life on a scale that was unconscionable and unacceptable. No government acting in accordance with its overarching duty to preserve life could ignore such advice or tolerate the number of deaths envisaged. The governments of the UK, in taking the ultimate step to impose a mandatory lockdown, acted in the genuine and reasonable belief that it was required. They had no choice by then. But it was through their own acts and omissions that they had no choice. Also, the failure to lock down earlier may have cost lives. Had the lockdown been imposed 1 week earlier than the 23rd of March, the evidence suggests that the number of deaths in England alone in the first wave up until the 1st of July 2020 would have been reduced by 48%. That is approximately 23,000 fewer deaths. The decision to impose the first UK-wide lockdown was remarkable for the failure on the part of all four governments to anticipate or plan for the possible need for a mandatory lockdown. Plans for imposing stringent restrictions and for lifting restrictions should have been worked up from the outset. They were not. None of the governments in the UK had adequately prepared for the challenges and risks that a national lockdown presented. They did not scrutinise sufficiently seriously its wider societal, workforce and economic impacts, in particular the impact on the vulnerable and the disadvantaged, and the impact of school closures on children's education and their physical and mental health. Many of the same failings were repeated later in 2020. This was inexcusable. The second wave had been predicted from early in the pandemic. The UK should have been well equipped to respond. Scientific understanding of the virus had matured and data flows were much improved. Testing and surveillance capacity had been strengthened. Each government had ample warning that the prevalence of the virus was increasing and would continue to do so into the winter months. Yet again, there was a failure to take timely and effective action. Such measures as were introduced in England were unlikely to be effective. For example, the rule of six and the tier system. Yet measures like a short circuit breaker lockdown that may have been effective were not imposed in late September or early October 2020. The evidence suggests that had one been imposed in September 2020, the second lockdown on the 5th of November could have been reduced in length and severity and might conceivably have been avoided altogether. Similarly, in Wales, there was a lack of timely planning in relation to the circuit breaker lockdown, which was imposed too late to bring about a significant reduction in the R rate, the figure that represents the average number of people infected by a single infected person. From August to December 2020, Wales had the highest age-standardised mortality rate of the four nations. It is likely that this was a result of a combination of failed local restrictions and the decision to relax non-pharmaceutical interventions too quickly. The decision-making in Northern Ireland was chaotic and infected by political machination. The strained relationship between ministers contributed to an incoherent approach. The circuit breaker restrictions were extended for a week, then lapsed for 1 week, before being reintroduced for 2 weeks, with the 1 week lapse in restrictions correlating to a 25% increase in cases. By contrast, the number of cases in Scotland in autumn 2020 did not peak to the same level as the rest of the UK. By using stringent, locally targeted measures swiftly to deal with outbreaks, case numbers grew much more gradually and avoided the need for a nationwide lockdown in the autumn. Nonetheless, in late 2020, all four nations were hit by a wave of cases. The more transmissible Alpha variant emerged in Kent during the autumn and drove a rapid rise in cases. The emergence of a more transmissible variant was entirely foreseeable, but all four governments failed to take decisive action in response. Rather than recognising the threat early on and introducing measures to control the virus, the four governments continued to press on with plans for relaxing measures over Christmas while cases grew rapidly, only to change course when levels of infection became critical. The failure to take sufficiently decisive and robust action in response created a situation in which governments saw a return to lockdown restrictions as once again unavoidable. In December 2020, the UK became the first country in the world to commence a vaccination programme. This was a remarkable achievement. However, it would take time for the programme to become fully effective. In the meantime, the new variant was still spreading. A failure to take swift and decisive action yet again led to the imposition of another lockdown and closure of schools in January 2021. However, belatedly, the four governments had learned some lessons from 2020 and planned their exit from the 2021 lockdown more effectively. All four governments sought to balance the relaxation of restrictions against the risk that potentially more transmissible and deadly variants would emerge. The task was made considerably easier by the vaccines programme. However, in late 2021, the emergence of the more transmissible Omicron variant caused an increase in infections and led to the further reintroduction of restrictions. An escape variant that can overcome immunity was repeatedly identified as the biggest strategic risk. Yet there were no detailed contingency plans for such a possibility. The sheer number of infections from the new variant demonstrates that had vaccines been less effective, or if the new variant had been as severe as previous ones, the consequences would have been disastrous. Yet with all their experience of the consequences of a pandemic and the response to it, governments still failed to act appropriately. In addition to reaching these conclusions, the inquiry has also addressed other important themes that arise from core political decision-making under the following headings: the membership role and functions of the administrative structures, particularly the emergency advisory bodies providing scientific and technical advice. The Scientific and Advisory Group for Emergencies, known as SAGE, one of the primary sources of expert advice, provided high-quality advice at extreme pace throughout the pandemic. But some aspects of its operation were constrained by the breadth and duration of its operation, the lack of clearly stated objectives by the UK government, and the repeated use of the mantra, following the science. This gave the false impression that decisions were being taken solely on its advice. As a result, some experts were subjected to appalling abuse and threats. What was done to protect the vulnerable from harm? Although the pandemic affected everyone in the UK, it was the vulnerable and the disadvantaged who suffered the most. They were the most affected by the restrictions imposed to control the virus. They were the ones most likely to die. Yet not enough was done to protect them from the virus or the response measures. Whether there were clearly defined, effective and transparent structures for government decision-making. Structures for government decision-making across the UK varied. At the start of the pandemic, the UK government did not have in place a sufficiently robust structure for decision-making long-term and largely bypassed traditional cabinet government. More effective structures were later developed, but this took time. In Wales, the Welsh Cabinet under the First Minister of Wales was fully involved throughout. In Scotland, decision-making rested with a small group of ministers led by the First Minister. She took responsibility for decisions, with the result that ministers and advisers were often excluded from decision-making. In Northern Ireland, the power-sharing arrangements weakened the ability of the executive to respond, and decision-making by the Northern Ireland executive itself was marred by political disputes. The pandemic response also exposed wider issues. The very least the public is entitled to expect is that those making the rules will abide by them. Across the UK, there were instances and allegations of rule-breaking by ministers and advisers that caused huge distress and undermined the confidence of the public in their governments. Finally, under this heading, there was a toxic and chaotic culture at the heart of the UK government, and the relationship between ministers in Northern Ireland was poor. This kind of culture is detrimental to good decision-making. How well the four governments communicated with the public. Communications with the public are a critical aspect of pandemic response, and messaging should be carefully crafted to reach as many people as possible, to be as clear as possible, and ensure maximum adherence to the message. For example, the stay-at-home message, developed by communications experts in Number 10 and without input from the NHS or behavioural scientists, was simple and easily understood. It was effective at maximising compliance with the first lockdown. However, its simplicity meant that nuances in the guidance and in the regulations were poorly understood, and people were discouraged from seeking help when they needed it. Other campaigns across the UK varied in their effectiveness. Legislation and enforcement. The UK government relied on existing public health legislation rather than the Civil Contingencies Act 2004. While this enabled rapid action, it came at a cost. It led to fragmented decision-making, reduced parliamentary scrutiny, and it caused public confusion. The regulations introduced were often overly complex and extremely difficult to enforce. Intergovernmental working. The choice of public health legislation to combat the virus meant that each of the devolved nations would be responsible for the response in their areas. Yet the UK remains one country and cross-border travel is constant. It is bound to affect any measures imposed. Close cooperation between the four governments is therefore essential. The inquiry heard there was a lack of trust between the then Prime Minister and some of the First and Deputy First Ministers that affected their relationship. Key lessons. The inquiry has identified a number of key lessons learned to inform the response to a future pandemic. They must be considered during the development of future pandemic preparedness strategies. They include the need for multiple scenario planning, the formulation of clear objectives, the need for more constructive working between the governments of all four nations, the need for better communication with the public, the importance of data, and the absolute requirement for quick and decisive action. In all, I make 19 key recommendations that I believe will better safeguard the UK in any future pandemic and improve decision-making in a crisis. They cover the operational workings of SAGE, the extension of the socio-economic duty within the Equality Act 2010, and the use of child rights impact assessments, reforming and clarifying the structures for decision-making during emergencies in each nation, ensuring that decisions and their implications are better communicated for the public, enabling greater parliamentary scrutiny of the use of emergency powers, improving the communication of rules to the public, and establishing structures to improve communication between the four governments during an emergency. I emphasise that further, no less important aspects of how the UK government and the devolved administrations responded to the pandemic are being separately addressed in other of the inquiry's modules. By the end of this year, we will have completed 9 of our 10 module hearings, with reports published throughout 2026 and early 2027. The inquiry's final set of hearings investigating the impact on society, Module 10, have been confirmed for February 2026. As with Module 1, I want to express my gratitude to all those who have given so much of their time and resources in supporting the inquiry's Module 2 investigation. I would like to thank the teams in Modules 2, 2A, 2B and 2C, and the core participants and their legal teams, without whose hard work, diligence and dedication, the hearings and this report would not have been possible. Finally, I want to thank those who lost loved ones or suffered harm in some other way during the pandemic, who gave evidence, contributed to the moving films played at each hearing, attended inquiry events, or contributed to the inquiry's listening exercise, Every Story Matters. They have all shown great courage. Their harrowing accounts not only help me and inform the inquiry's work, but they serve for all time as a reminder of why the work of this inquiry is so important. Unless the lessons are learned and fundamental change is implemented, the human and financial cost and sacrifice of the COVID-19 pandemic will have been in vain.
Well, Baroness Hallett there, the chair of the UK COVID inquiry, describing the response to the pandemic by the UK's four governments. In her words, too little, too late. Well, the COVID inquiry report found some 23,000 lives in England alone might have been saved had a mandatory lockdown been imposed a week earlier on or immediately after the 16th of March 2020. The report also found that the Department of Health and Social Care misled the public by giving the impression that the UK was well prepared for a pandemic. The report says the lockdowns of 2020 and 2021 undoubtedly saved lives, but only became inevitable because all four governments got things wrong. Well, joining me now is our Deputy Political Editor, Sam Coates, who's been taking a closer look at the key points. And Sam, scathing doesn't really cover it, does it?
That's right. This is a report, though, Jane, that is going to cost the taxpayer, once the COVID inquiry is all in the region of £200 million. Days, weeks, months of witnesses and hearings, 80 witnesses, 166 giving, so 80 public hearings, 166 witnesses. So this is an inquiry on an epic scale. And you are right that the headline that the chair of the inquiry wants you to see is an utterly damning indictment of Boris Johnson's government, the way that it handled it and handled the COVID pandemic in 2020 and 2021. There is criticism of the manner in which Boris Johnson went about things. They say that he was over-optimistic. They criticise the decision-making across the UK, and they really gun for the structures and some of the decisions of individuals concerned. But this is an exercise on an epic scale. So if you pull the camera back, I think we ought to just sort of ask whether or not it does the job on its own terms. Given the cost of this inquiry, really I think it can be judged against three things. First of all, does it tell us stuff that's actually new, that we didn't know, having lived through this crisis? Does this report just regurgitate broadly what was in the media and in the public domain already? Secondly, is it going to lead to any consequences for any individuals? Is this a moment of reckoning where particular people find that their actions are judged and there are consequences for those? And thirdly, are there recommendations that are really viable that would stop this doing and happening again in the future? And I have to say, Jane, if you were to apply the most cynical take on this report, it isn't absolutely clear, for all the damning language and for all the criticism of politicians that are have now left the political scene, that the answer to that is yes. What this report does is reflect some of the disorganisation and the panic that was in government and some of the bad decision-making. But it does sort of apply a Panglossian test on how government might work in the midst and the heat of a crisis. When it comes to particularly trying to come up with suggestions for the future about how things might be better, essentially this report just says, do better. So it asks that governments have better strategy, act quicker, work together more constructively, and use data better. I mean, I don't think any government ever would say that not trying to adhere to the highest standards across those things would be their aspiration. The question is, has this report got under the skin of the politics of what was going on sufficient to provide a practical and realistic improvement to the way that things operate? And we are just going to have to see over time whether that is the case, as it suggests, for instance, more equality duties and taking account more rights. we were in the middle of a gigantic national emergency, and there were tensions between politicians and between the different bits of the UK government, particularly the devolved administrations and the government in Westminster. Those things are a function of extremely difficult decisions being made at pace. The question is, has there been anything that's going to lead to further consequences for people? Well, let's look at who remains in government, who is being criticised today. Quite a lot of this report deals with figures who bluntly have more or less left the political scene. We don't hear so much these days from Boris Johnson. He's no longer an MP. Matt Hancock also consigned to the political bin. But there is a figure which is the most senior Mandarin in the country. He's Chris Wormold. Now, he is a prominent figure in this report because he was the head civil servant in the Department for Health, DHSC, Department for Health and Social Care. And the report is pretty damning about the kinds of things that he should have been doing at the beginning. And what the report really does when it comes to Chris Wormold, who's now Keir Starmer's top civil servant, is to say, first of all, that there was no plan. And secondly, that Chris Wormold was quite happy to allow the Secretary of State at the time, which was Matt Hancock, be overly optimistic about the state of planning, which was close to non-existent for this type of pandemic. He was quite happy to allow Matt Hancock to give an overly optimistic view of the government's preparedness. There was a line, and we remember it from the time, we remember it from early 2020, that Britain, we were told, is one of the best prepared countries in the world, if not the best prepared country in the world in the event of a pandemic. That turned out to be utterly untrue. Chris Wormold, this report identifies, is the person who allowed that language to be used, and this inquiry thinks that he should have shut it down. Now, we haven't had a response yet from government about whether or not Keir Starmer feels that there is a level of culpability attached to Chris Wormold for this, or whether or not he will face consequences for this. We will hear, I think, from Keir Starmer on Monday when he responds in the House of Commons chamber to this report. But that's the kind of thing, that's the kind of test of whether or not this report is meaningful and will have consequences. Because it is, I have to say, all too easy for the 800 pages of this section of the COVID inquiry, and there are many, many more modules left to come, to sort of float off into the ether and for the worthy recommendations of better working and better cooperation and better aspirations for how you deal with data to just be allowed to sort of float off into the ether. Is this government going to change specific things? And is this report going to mean that blame, in a way that I think a lot of the victims and frankly, a lot of the public are expecting there should be blame for some of the ways in which the coronavirus pandemic handling went wrong at the top of government? Well, what you get as you flick through the hundreds of pages is that blame is very, very diffuse. There, everybody cops it in this report. But because everybody cops it, everybody's to blame, and consequently nobody really gets any. There are no real consequences as a result of that. The kind of the ladle of manure is spread very, very widely through this report, from the way that different devolved administrations worked internally to the way that they were handled by central government, to the scientists who were absolutely key and on our screens every night, Patrick Vallance and Chris Whitty. Everybody cops it, and to a certain extent that's fair. But if you are looking to change things, the very wide blame and then the very wide nature of the recommendations and the sort of broad brush nature of the recommendations does just raise the question of whether or not this report, for all the expense, for all the hearings, for all of the detail that it goes into, and you can get quite lost in the detail, frankly, detail not necessarily a function of a good report, just floats off and doesn't really result in any meaningful change at all.
Sam, thanks so much for going through that and for giving us political implications of what has been announced this afternoon. Thanks a lot. We will return to Sam in a while. But in the meantime, let's go to Chris Callender, who's head of civil litigation at the Just for Kids law company. Chris, good to talk to you today. What was your reading of what Baroness Hallett had to say about the lessons that were learned, especially for youngsters?
Yeah, we're really pleased with the inquiry in the way that it's recognised the disproportionate harm that it caused children during the pandemic, and particularly the most vulnerable children in our community. What we realise now, and the way that she sums it up, is there was a toxic and chaotic culture at the centre of the UK government during the pandemic. There were a number of individuals who were destabilising that, and Mr Johnson, the then Prime Minister, reinforced a culture in which the loudest voices prevailed, and very few of the other colleagues, particularly women, often went ignored to the detriment of good decision making. The effect of which was children had reduced access to play when this appears possibly unnecessary, and would have had disproportionate.
Chris, I'm so sorry. We're just going to have to cut across you, Chris, because the COVID bereaved families are making a statement by the COVID wall.
If Johnson had listened to scientific advice and locked down even a week earlier, around 23,000 people could have been saved. Instead, throughout the pandemic, Boris Johnson put his political reputation ahead of public safety. He pandered to his critics when the UK needed decisive action. In delaying lockdowns, he made them longer, more damaging to the economy and less effective. He ignored scientific advice that didn't fit his agenda. And he ignored the impact of his decision on the front line, repeating the mistakes of the first wave and prolonging the second. To make mistakes is human. To refuse to listen to frontline workers, vulnerable people, the insights of devolved leaders, or those at the heart of government to hold parties while many of us died and grieved alone, shaped the government's approach to the pandemic and led to loss of life at an unprecedented, avoidable scale. While we reflect and mourn what could have been, what extra years, days and hours, we could have spent with our loved ones, we need to reflect on how we, the public, were left so vulnerable. We can't just hope that we have better leaders in the future. The government must implement the safeguards recommended by the inquiry immediately. Otherwise, we are no safer now than we were during the darkest days in UK's living memory. Thank you.
Well, no questions there for the gathered media. That was Deborah Doyle from the chair of the bereaved COVID families making a statement by the COVID wall down there on the banks of the Thames. Deborah Doyle, she lost her mum to a care home in 2020. I think we've got another spokesperson there. Let's listen in.
Reading Module 2 and Module 2C, we feel that the chair has very much hit the nail on the head, especially when it comes to Northern Ireland. In Module 1, on one level, we felt like a footnote, but we can't say that in Module 2C. She has made some really good recommendations in relation to how the First and Deputy First Minister need to, in the case of an emergency, have an oversight, so that mechanism needs to be put in place. She's also highlighted the issues with the Chief Medical Officer and how he's wearing too many hats, and realistically it should be an independent role that has no management involvement in the Department of Health. She's highlighted the lack of a socio-economic guidance in relation to Article 75, and that needs to be amended. She talks about the toxicity. She talks about how the political histories take over that of the needs of society in Northern Ireland, and quite often the veto that stops decisions being made is used inappropriately. And I think it's very much clear that this inquiry has been needed to show why things need to change across the four nations, and we as a society deserve so much better. Our next big thing is to work with all administrations to ensure that these reports, which are quite heavy, and I'm hoping EasyJet don't charge me extra baggage to get back to Northern Ireland, they need to look at them, they need to work with us, and they need to ensure that they're implemented And if they're not, I want to know why, as does the families within our group that we represent. I very much found today emotional. My mummy died on the 24th of March 2020. And the chair's made it clear that had a lockdown been a week earlier, people like my mummy would have been saved, or quite possibly. The same way that failure to learn from the lessons in the first wave impacted on the second wave. So now we know somewhere along the line in the future, there will be a further pandemic. There will be no excuses. It's in black and white in Module 1, Module 2, A, B and C, and the future modules. Now it's up to those who are paid to look after every single member of society, and especially in Northern Ireland, not to hide behind the political structures, because there's means and ways to change. And if they think it's too difficult, they just need to come and talk to us, members of the public, because I can tell them how it needs to change. Thank you very much. Thank you.
Well, that was Brenda Doherty from COVID Families for Justice Northern Ireland, giving an emotional response to this second report, the second module of the COVID inquiry. And both her and Deborah Doyle broadly welcoming what they've heard in the reports today, highlighting where they say things have definitely gone wrong, and being really hopeful that it will prove to a change in the future. Let's return to Chris Callender, who's the head of civil litigation at Just for Kids Law. Sorry for cutting into you there, Chris. So we heard from both of those people who desperately, sadly, lost loved ones during COVID, of the impact it clearly had on them. We were talking to you about young people and children in particular. What do you think Baroness Hallett pinpointed that's important to you in terms of young people and how their experience might have been different if things had been done differently by government?
Yeah, thanks. That's a good question. Just to endorse what we've just heard there, it's very moving and really important that those lessons are learned. And I think in respect to children across the United Kingdom, what wasn't understood was the impact that those restrictions would have on them, the impact of restrictions on play, and the importance of play to children's development and their early years. There was a failure to communicate with children and communicate in a way that children would understand. There was no press briefings or any direct or specific child-centred contact. There was no real understanding of the impact of the closure of schools. We know that the closure of schools wasn't really considered until March. That was 3 months into the timeframe when the government was aware that they may need to take significant, important steps. As a result of the closure of schools, you had children unable to learn, children unable to take exams, and also the really significant role of schools as a vital part of the child protection system. And so many children went invisible and actually still remain invisible because of the failure to record births during the pandemic period. So lots to learn. Many criticism made by the inquiry in respect of the way that government was managed, departments were managed, and the poor communication that resulted there in the course of that poor planning.
Christy, do you feel, listening to Baroness Hallett, that she's put her finger on the points that need to be addressed, and that what she's suggesting in terms of her proposals would make a difference to youngsters should there be another pandemic next year, say?
I think she does, and I think that requires the government to act quickly. There's the Children and Wellbeing Bill going through Parliament at the moment, and one of the recommendations by the inquiry is the use of something called the Children's Rights Impact Assessments. The effect of that would be that in each decision made by government, there would be an assessment of the impact on children and children's rights. And we think that's something that the government could implement now in order to avoid bringing ordinary childhood to a halt, which were her words, in any future pandemic.
And Chris, you talked about a little earlier when we first spoke about the culture in Number 10, and I wonder how much you think that Baroness Hallett talked about a culture of misogyny, how women were talked over at Number 10 and ignored. Do you think that had a direct impact on children? I'm obviously not just saying that women are the only ones who should be responsible for childcare, but do you think that perhaps some of the concerns about children might have been at the forefront of some of those women's minds, and that because they weren't being listened to, the children directly were affected?
Oh, I think that's absolutely right and absolutely the case. Just for example, on the issue of free school meals, we've heard and read in the inquiry that none of the people around the table, none of the key decision makers had ever experienced a situation where they may need access to free school meals. There was definitely a male culture and a privileged culture around the decision making, and there was a lack of understanding of the impact on children and other groups within our community by making these decisions and by imposing these restrictions. So I think absolutely that would be a key lesson to learn from that, and ensuring that there's wider understanding of the impacts on communities as a whole. And hence why we would say, for example, there ought to be a children's minister at cabinet level. So when the cabinet are making these decisions, all department heads are reminded, what about children? And that could apply across the board to all other groups of people within our communities.
Chris Callender, Head of Civil Litigation at Just for Kids Law. Really interesting to get your response to Baroness Hallett's latest report. Thank you very much. Well, let's remind ourselves of the events and some of the measures that the government took to try to protect the public. In January 2020, the UK had its first known COVID death, 84-year-old Peter Atwood, who was from Chatham. In March, the then Prime Minister Boris Johnson announced the first national lockdown. This was then eased in June. In November, the second lockdown began, and a month over, the rollout of the vaccine started. Well, let's return now to our Deputy Political Editor, Sam Coates, who's been taking a closer look through the key points of what this report has unveiled. Sam.
Thanks, Jane. So, £200 million, that's going to be ultimately the cost of the COVID inquiry. Today, we have had the second module, the inquiry into the politics of what has happened over the last, during the pandemic. The headline is clear, 23,000 extra deaths, which could have been prevented, were the consequence of locking down too late. This is the document. Let's look at the key headline that you'll be seeing across Sky News all evening, and that is that if they had imposed a mandatory lockdown 1 week earlier, then they could have saved up to 23,000 lives. That's a headline that will vindicate many of those who I think felt that the government acted too late and there was a direct consequence, something that they denied at the time. But let's take you through some of the specific things that the inquiry has highlighted. Look at this. Boris Johnson was the Prime Minister at the time, and the inquiry found that Boris Johnson's own failure to appreciate the urgency of the situation was due to his optimism. They criticised the character of the PM and that he thought that the pandemic would amount to nothing and basically thought that it was going to be a little bit like disease infection spreads of the past. And he basically completely bought the assurances of the Cabinet Office that pandemic planning was robust. So complacency and the character of the Prime Minister are blamed here. Now, one of the things that you'll notice, Boris Johnson, Matt Hancock, many of the key figures are no longer on the political scene, but one figure is. He's the head of the civil service now. He's called Chris Wormold. He was, at the time, head of the Department for Health and Social Care. So his role, which is heavily criticised in this report, is key. The report says that Christopher Wormold's responsibility to rectify over-enthusiastic impressions that Matt Hancock, then Health Secretary, had given to 10 Downing Street about the ability to cope with its role in the pandemic response. He basically failed in that. There is no evidence that Wormold took such action. His failure to do so gave rise to additional concerns that the UK government would be effectiveness, and questioned his leadership. And there's a bit more on Chris Wormold here. Mr Hancock justified assurances to 10 Downing Street and the Cabinet Office that the Department for Health was managing the crisis effectively. His failure to rectify these assurances obscured the reality and the need for more. we haven't had anything from government about what they think about this. I suspect Keir Starmer trying to avoid the question directly. Can the top civil servant in the country remain in place? Now let's look at some other figures. Patrick Vallance, Lord Vallance, is now a member of the Labour government. He is criticised, along with another face of the pandemic, because he had worried about behavioural fatigue if there was a lockdown too early. That, they say, has no grounding in science. Can he remain in his post? But then, will this report really result in change? What it effectively recommends is that there should be better working, better planning, all of that kind of thing. Leaders must work constructively within their own government and across the 4 nations. A report that ultimately concludes that everyone needs to work better together. Is that going to result in fundamental change in our system?
Well, we certainly will wait and see. Sam, thank you so much for that. Sam Coates talking us through in some detail some of what Baroness Hallett has revealed today. Let me just remind you, if you're just tuning our way, that the government, chaos at the heart of government and a failure to take COVID-19 seriously are the key things that Baroness Hallett has said we should take away from the second part of the second module of the COVID inquiry. She says, if we'd taken the first lockdown a week earlier, some 23,000 lives might have been saved. She also has been enormously critical of the former Prime Minister Boris Johnson and the toxic culture that she called it in Number 10. She said the fact that the government kept changing its mind, cabinet ministers, including the Health Secretary, Matt Hancock, all failed to act with the urgency that was needed to tackle the virus. She also talked about Dominic Cummings, saying that he used offensive and misogynistic language, poisoning the atmosphere in Downing Street. Many women were talked over and not listened to. Fundamentally, her advice is that the government did not take the warnings seriously enough. She's made a number of recommendations. We'll be getting full analysis of all of this in the news at 5 coming up next.